Welcome to our PRV dental video about dental implant removal. When is it time to consider getting a dental implant removed? In this video, we will discuss the anesthesia options available for the procedure, the recovery time after dental implant removal, and possible complications. The recovery time for dental implant removal depends on the case and the surgeon's skill. You should contact your dentist for further information. If you are thinking about getting dental implants removed, here are some important facts you should know before your surgery. Listed below are the common complications that occur during the procedure and their causes. Anesthesia options for dental implant removal. If you have a dental implant, you may wonder what the best anesthesia options are for dental implant removal. There are several different types of anesthesia, and you should choose the one that will best meet your specific needs. Some people may prefer nitrous oxide sedation or local anesthesia, while others may benefit from general anesthesia. Whatever your preference, you should be comfortable during the procedure. If you have extreme dental anxiety, you may want to consider general anesthesia. General anesthesia is the most common type of anesthesia, as it induces unconsciousness. An oral surgeon will administer the medications to the patient through an intravenous line, and oxygen is delivered through a nasal breathing apparatus. Regardless of the type of anesthesia, the staff at 7x7 dental implant and oral surgery specialists are experienced, trained, and qualified to safely administer this type of anesthesia. Lidocaine is one of the most common forms of local anesthesia and can be used in combination with other forms of anesthesia. Nitrous oxide is a common type of anesthesia that allows the patient to remain conscious but not feel pain during the procedure. It is commonly combined with a local anesthetic to make the procedure more comfortable and less scary. Other types of sedation include intravenous sedation, also known as laughing gas, which is administered directly into the bloodstream. In the latter case, the patient will lose consciousness and may not remember the procedure. While opioids can be used for dental implant surgery, you should avoid taking them in conjunction with alcohol or certain medications, as they can cause side effects. A safer alternative is Exparel, a narcotic-free anesthetic that provides lasting relief. Anesthesia options for dental implant removal are largely dependent on the type of procedure you're having done. Your dentist will provide you with a prescription for a narcotic-free anesthetic. Procedures for dental implant removal. Depending on the location and length of the implant, dental implant removal requires different surgical procedures. The goal of dental implant removal is to remove the failed implant. The surgical procedure is much more complicated for upper jaw implants than those in the lower jaw. After the surgical procedure, patients must follow the same postoperative instructions for 2 days. They should avoid touching the implant site and should drink only cold liquids. A postoperative visit is necessary to recover from the anesthesia. Dental implants are bonded to the bone surrounding them. This means that if one fails, the implant will remain attached to the bone and can be removed with minimal damage. However, there is always a chance of infection, which can weaken the bone surrounding the implant. If the implant is placed incorrectly, it could also fail. In either case, it's important to schedule a consultation with a dental surgeon to ensure that your implant is safe. A failed dental implant can be removed with little pain if it's attached to healthy bone. The procedure uses a trough burr to cut the bone surrounding the implant, loosening it. The area around the implant is cleaned and an oral surgeon will determine whether bone grafting is necessary to replace the missing bone tissue. Bone grafting restores the area for replacement. The entire process typically takes about a half day. Another type of dental implant removal procedure involves the use of a trephine, an instrument that is hollow with serrated edges. The trephine is a 5 mm internal diameter tool that can be used to remove implants that are 4 to 10 mm in diameter. The device is connected to a motor and rotates at 2,000 revolutions per minute. The trephine removes the top 5 mm of bone, weakening the implant's bond. A dentist can then insert an implant driver into the implant, reversing it when the procedure is complete. Although dental implants are designed to last a lifetime, sometimes they do become loose and need to be removed. This can be due to a variety of reasons, such as gum disease or a faulty surgical procedure. Additionally, the implant can become infected, resulting in an abscess. If not treated correctly, an infection can spread to other parts of the body. A qualified dentist will take these factors into consideration when performing a dental implant removal procedure. Complications of dental implant removal. In order to achieve the best outcome, surgical methods for implant removal should be safe, minimally traumatic, and effective. However, the success of these procedures depends on the technique selected by the surgeon. The current literature includes few systematic reviews or case series on the removal of dental implants. Therefore, it is necessary to carefully review all available literature before choosing a method. In this video, we will discuss the pros and cons of each technique and the best practices for implant removal. The most common dental implant complication is loosening. There are various reasons why a dental implant may loosen, including bone loss, poor oral hygiene, and smoking. To ensure the safety of your dental implant, make sure to follow the aftercare instructions carefully. If you do not, you risk damaging your teeth and implant. Regardless of the cause, you should never neglect your oral health. In addition, peri-implantitis may require the removal of the implant and subsequent bone loss. Aside from pain, dental implant surgery can also lead to tissue damage, which occurs when the surgeon places the implant too close to a nerve or tissue. A patient will usually experience increased pain in the area after the procedure. Other signs of foreign body rejection include swelling, fever, and chills. Patients should seek medical attention immediately if they experience any of these symptoms. The recovery time for simple dis is generally short, but patients should always follow the surgeon's instructions closely. There is also a risk of sinus complications. Because implants fuse with bone on all sides, the dentist may need to take extra steps to increase the volume of the bone surrounding the implant. Missing teeth also cause bone volume loss. But an experienced implant dentist can increase bone volume by adding bone graft. However, this procedure is not without risk. In some cases, an implant may fail due to unnoticed rejection. Another concern with implants is the possibility of nerve damage. Implants near a nerve can lead to pain and tingling. A failed implant may require surgery to correct the problem. If this happens, a second consultation is necessary. If you have any concerns, contact your oral surgeon as soon as possible. So, don't delay in scheduling a dental implant. It will be worth the extra expense to avoid future problems. Recovery time after dental implant removal. If you've recently had your dental implants removed, you're probably wondering what to expect during your recovery time. After all, there's a lot to keep in mind. Generally, you shouldn't drink anything hot or spicy for 24 hours after your procedure. You should also refrain from drinking any kind of liquid from a straw. Eat soft, bland food and take your prescribed medication as directed. But what should you avoid? The length of your recovery will depend on the specific procedure, your age, and your physical health. In general, your recovery time after dental implant surgery will take anywhere from 4 to 6 months. However, your recovery time will be shorter if you have certain medical conditions or need to undergo additional procedures, such as a bone graft or sinus lift. Your dentist will discuss any specific recovery time with you to ensure that everything is going well. While the majority of dental implant patients experience some discomfort during the first 2 days, pain is expected to lessen over time. You should take prescribed pain relievers and give yourself time to recover. Pain may last up to 7 days, and it should start to disappear by week 2. If you still experience pain after 2 weeks, call your dental surgeon to discuss the situation. If your implant hasn't fully healed after 3 months, you may have a serious complication, either an infection or inadequate blood supply. After dental implant placement, you'll need to take antibiotics and take pain medication as directed. Your dentist will provide you with pain medication after your implant surgery. You should also follow your dentist's instructions carefully. You may also have swelling of the gums and minor bruising. If you are unable to follow your dentist's advice, take pain medication prescribed by your doctor. And make sure you follow any aftercare instructions to the letter. Fortunately, the recovery time after dental implant placement is considerably shorter than the recovery time of other surgical procedures. In most cases, the implant will fuse with a healing bone around it after a few weeks. Then, you can start using the implant within limitations while you wait for the healing period to be completed. However, you should be aware that you may need to undergo a second surgery to remove your dental implant completely. You should keep this in mind when deciding on the right procedure. Thanks for watching. Please like, comment, and subscribe.